All right, and we are recording. So, good morning, Miss Johnson. It's nice to meet you.
Good morning. Nice to meet you.
Morning. I'll be interviewing you today for the position of the family nurse practitioner in one of our rural community clinics. First, tell me a little bit about your nursing background and why you decided to become a nurse practitioner.
All right. I've been a nurse for 15 years. I recently graduated from Northwestern State University with my master's. My passion for patient care and desire to make a difference is why I decided to become a provider. Throughout my 15 years, I started out in ICU, and then I moved to surgery. When I moved to surgery, that's where I felt that it was my work family and my work home. I work side by side with the anesthesiologist, and during this time, I learned to look at the patient as a whole. And um, for this, I'm confident in my ability to provide comprehensive care while collaborating with other healthcare professionals.
Thank you. Very good answer. Appears that you have a good, strong nursing background. What other qualifications do you have that you feel could make you an asset to our agency?
Aside from graduating with my master's in nursing from an accredited university, I now have a Louisiana APRN license and I'm certified as a family nurse practitioner through the ANCC. I am in the process for my DEA license and MPI number. I also have BLS and I'm ACLS certified, and I have a RN license.
All right, great. That's helpful to the credentialing process. As well as it's also a necessary requirement for the position. But the full qualifications of the position are, we're seeking an NP candidate that has adequate bedside nursing experience, including, but not limited to, critical care, ER, med surg, or the operating room. New NP graduates are welcome. No prior NP experience is absolutely required. Education requirements is a master's degree in nursing from an accredited university. License requirements is Louisiana RN license, with no felonies or anything like that, and Louisiana nurse practitioner license and family nurse practitioner certification through the American Nurses Credentialing Center, a DEA license, and then BLS certification at a minimum, and a drug test and a work physical prior to hire. What skills and attributes do you have that you feel would make you an asset to the team?
I get along with other people. I'm a quick learner. I am great at managing my time. I'm able to stay calm and clear minded in a busy, chaotic environment. And many years of my patient care combined with my thorough training from Northwestern State University have made me very knowledgeable of chronic and acute medical conditions and how to effectively manage them.
Awesome. We're, as you probably already know, we're very, very busy here at the clinic. Typically, as a provider, you will most likely see 20 to 25 patients per day. How would you say you manage your time effectively?
I prioritize tasks based on urgency and patient needs. I delegate tasks to other team members that can be delegated and communicate effectively with other team members.
Okay. So what is your understanding of the NP's responsibilities?
The American Association of Nurse Practitioners states that along with clinical role, MPs may serve as healthcare researchers, interdisciplinary consultants, and patient care advocates. MPs provide a wide range of healthcare services, including they diagnose, they manage acute, chronic, and complex health problems, disease prevention, health education, and counseling for the families, groups, and for the community. As the provider, I'll assess, diagnose, plan of care, implement that plan of care, educate, and follow up.
Great answer. It seems that you have a basic, generalized understanding of the NP role. I'll go ahead and tell you a little more in detail about the roles and responsibilities of this position. First is the ability to be knowledgeable and comply with company standards of operations. the ability to maintain friendly, cordial relations with all clients and employees, and maintain a positive work atmosphere by acting and communicating in a manner that results in a positive work relationship with customers, coworkers, and managers, lead clinic staff in behaviors, actions, and attitudes, in delivering excellent patient care, provide guidance as necessary to ensure quality professional services and patient satisfaction, ensure accurate completion of patient charts in a timely manner and forwarding charts as appropriate daily, as well as build and maintain confidence and credibility with all employees, implement clinical protocols as outlined by the CMO and certifying physicians, maintain behavior that is compliant with federal and state regulations, guidelines, and requirements, including working knowledge of all health information management issues such as HIPAA, order, perform, or interpret the results of diagnostic tests, as well as responsibly prescribe medications and educate patients on continued treatment and care of acute and chronic conditions, perform therapeutic procedures, including but not limited to IND, splinting, suturing, managing infection, and wound care, analyze and interpret patients' histories, symptoms, physical findings, and diagnostic information to develop an appropriate diagnosis, ensure accurate completion of patient charts in a timely manner, and forwarding charts as appropriate daily, and the ability to adhere to the core values of the company of teamwork, communication, empowerment, quality of care, and friendliness. Do you have any questions about your responsibilities?
Yes. Can you tell me what my job description is at this facility? Like what are the hours? Do you work any weekends? Do you have, I guess that information?
Yeah, no, that's important stuff. So based on the position, it's going to be from 8 a.m. to 4 p.m. from Monday through Wednesday, and then 8 a.m. to 1 p.m. on Thursdays. You're off on, Friday, Saturday, Sunday, and major holidays as well. You're expected to see about 20 to 25 patients per day in a clinic setting, sometimes less, sometimes more. It really just depends. The clientele are predominantly insured with Medicare and Medicaid, or they're uninsured. And let's see, you're expected to diagnose and manage acute and chronic care in adults age 18 and up. Your role is expected to be a provider as well as an educator. There's a possibility of you being asked to provide education to our staff in regard to infection control, etc., stuff like that. You're expected to collaborate with on-site pharmacy, radiology, and lab to facilitate patient care and solve problems in the clinic setting, to practice in accordance with the Christus mission and values.
Okay. Could you tell me what the Christus mission and values are?
Yes, I can. The mission of Christus is to extend the healing ministry of Jesus Christ. Our mission is to be a leader, a partner, and an advocate in the creation of innovative health and wellness solutions that could improve the lives of individuals and communities so that all may experience God's healing presence and love. Our values include dignity, integrity, excellence, stewardship, and compassion. Dignity is the respect for the worth of every person, recognition and commitment to the value of diverse individuals and perspectives, and a special concern for the poor and underserved. The creation of the Christus Community Clinic aligns with this because it allows MPs to provide care to the poor and underserved in our community and tending to those in poverty who need it most. Why do you want to work at the community clinic?
So I love what the clinic stands for. It's family centered. It seems like it's everything that I went to school for. So I truly believe that it's not only the person that we're caring for, but the family as well. And I do believe that I could provide the level of compassion and excellence that your agency is looking for in a provider.
Good. I do have a few questions now that assess your critical thinking abilities, your communication skills, and your ability to handle challenging situations. So suppose your patient starts showing signs of an allergic reaction after giving, I don't know, like a pneumococcal vaccine. What are you going to do for this patient?
First, I would determine the severity of that reaction. If the patient's airway becomes compromised, I will follow the facility's protocol to administer emergency medical care and will delegate someone to call the ambulance services. In this scenario, I'm assuming I would have to assess an EpiPen and oxygen through like a non-rebreather that I could give to the patient. After after administration, I would monitor the patient one-on-one until the ambulance service arrives.
Okay, good, quick thinking. What is the best way to effectively communicate to your staff to delegate tasks in this scenario?
The best way to communicate is by giving clear, direct instructions. For example, I would say, Gail, please grab the emergency kit. If the event were to escalate before EMS arrived, I would verbalize clear roles and responsibilities to my team members to prepare for possible life-saving measures.
Great. Now, suppose the patient you're assisting has a family member with them that is panicking and becoming irate and aggressive while we're waiting on EMS. What is your best course of action to settle this person?
I would first attempt to calm the patient down by reassuring them in a calm tone. And if this doesn't work, then the family member actions start to interfere with the patient's care. Then I would calmly inform them that security will have to escort them off the scene until I can get the patient stabilized and debrief them afterwards.
Okay. I agree with all your answers, and I believe that you would handle that scenario pretty well. Before we start talking about pay, do you have any questions for me?
Yes, family is very important to me. I want to make sure that I am making the right decision that allows me to see them more while also having good benefits and to provide for them. What are some of the benefits that are offered here?
So we offer competitive compensation and benefits such as holiday pay, PTO, medical, dental, vision, and work-life balance. We are insured through Blue Cross and Blue Shield of Texas. I myself have this insurance and have found out that a lot of services are covered with low deductibles and out-of-pocket rates. The Christus organization pays for a large portion of your medical insurance to keep monthly payments low for our employees. In addition, we also offer several optional opportunities for term and whole life insurance, accident coverage, and short-term and long-term disability coverage. We will also pay for your malpractice insurance as well. Our 3.5 days a week schedule are an ideal fit for mothers who would like to spend more time with their families.
All of that sounds wonderful. How does insurance reimbursement work at this facility?
So the MP will bill the insurance company under the MPI number, as well as utilizing the appropriate ICD-10 and CPT codes. When billing Medicare, the MP can only bill for one service at a time per day, and reimbursement will be 85% of the fee schedule amount. MPs are not paid on an RVO basis. That's basically it. But let's talk about salary. Did you have an idea of what you would like to be paid?
I've researched the market in this area for outpatient clinic jobs, and the average salary seems to be around $115,000 per year. With all the benefits you've mentioned, I could do 110 per year, but I don't think I would take anything lower.
I mean, I think that's reasonable. I would have to discuss a little more with HR, but I think that a number between 110 to 115 a year is pretty reasonable for a new grad MP. I would be willing to even discuss with them a possible sign-on bonus.
Oh, that's great. Thank
Um,
you.
Welcome. I really enjoyed talking with you today, and so far, I like what I see. I think you would be a valuable asset to our team. Do you have any other questions for me?
No, I don't. I just want to say thank you for giving me this opportunity to interview with you. I would love to work here and for this organization. I love the faith-based ministry of Christ and what that stands for. And for, Christ and Christus, their value and their mission line up with my morals. And I would be honored for the opportunity to grow as an MP with you.
Well, thank you, Heather. We will be reaching out to you soon with an update.
All right. Thank you.
You're welcome. Talk to you later.
Bye.